to Dr. Ben Moha's office. Come follow me. Okay. We're going to take a look at her office and see everything that we're doing. So as you walk in, come on in, don't be shy. Hello.
Hi, how are you?
Good, how you doing?
Good. Welcome to Dr. Ben Moha's office. This is our lobby,
Okay.
waiting area, and I'll bring you in to see the doctor.
Excellent. Looking forward to it. Sure. Great. Thank you. There you go.
And she's right in here.
Excellent. Thank you. Hi, Dr. Ben Moha.
Hi. Hello. Hello. How's everyone?
Great.
Good to see you.
Dr. Ben Moha, what should each participant expect every time they come for an office visit?
When the contestants will be coming in, they all will have an EKG initial. They're going to have blood work to check their cholesterol, to check their sugar. We're going to do a sugar at the time and a 3-month sugar, what's called hemoglobin A1C. We're going to check everybody's kidneys, liver functions, okay? Because many people that have obesity, morbid obesity, have what's called fatty liver. So that's very important to check for. And we're going to check everybody's thyroid that affects metabolism. So everybody will get that initially.
Okay.
And then they will come and see me every 2 weeks to make sure that their blood pressure is normal, they're not having any kind of chest pains or pulmonary problems with shortness of breath, or any medical problems. And then every month thereafter, we're going to repeat blood work because a lot of the contestants are diabetics or pre-diabetics. A lot of the contestants have high blood pressure or borderline blood pressure. Many of the contestants have fatty liver, which means that their liver functions are elevated. So on a monthly basis, I want to see changes in terms of their blood work, in terms of their progress, in terms of their blood pressures, that maybe I can cut back the medications. If they're diabetics, maybe I can take them off some of the diabetic medications. So the goal here is to help the contestants lose weight and become healthier.
Okay. One of the things that I understand is that you will be also weighing them as well?
Everybody will be weighed initially. We'll do a body mass index, okay? And then every Wednesday we'll have meetings, group meetings. Everybody will be weighed in.
Can you explain what BMI is?
Yes, body mass index is if you take a group of people, age, weight, it gives you an average of what someone should be weighed. Anything less than 25 is considered normal.
Okay.
Anything greater than about 30 is obesity.
Okay.
So everybody will get a body mass index, and everybody will be weighed again every week to see what changes have transpired.
And they'll also be weighed in at Max Fitness, correct?
Yes, absolutely.
Okay.
Yeah. That's where we're going to have the group meetings every Wednesdays.
Every Wednesday at 7:30. We'll
Yes.
have group meetings every Wednesday, 7:30. One of the things that I always wanted to know is what motivated you to get involved with this program?
Over the years that I've practiced medicine here in Plainview, which would be 12 years, there's been an explosion of obesity, of diabetes, of high cholesterol, of progression of elevated blood pressures, and everybody's gaining weight.
Mm-hmm.
Okay, it's normal over the years to gain 5 pounds, 10 pounds, but there's an epidemic out there. And if you want to take all the states and the world, there's actually a pandemic out there of obesity.
Right.
And more people are showing signs of heart disease. I actually see more women now with heart disease than I do men.
Wow.
And if you go to St. Francis Hospital, that's the center of heart disease.
Right.
If you go to the emergency room, it's more women than men. So it used to be that we were protected with our estrogen. And once menopause came and there's no further estrogen, we were equal to men. But now studies have shown that even if you still have your estrogen before menopause, women still have heart attacks in their 40s in late 30s.
So women are now at a higher risk
Correct.
of heart attack
Correct.
due to the obesity.
The diet,
Right.
the American diet is a problem, unfortunately, and it's not only America. It's transpired to the other countries as
Right.
well.
One of the nice things is that we're doing something here local.
Right.
Okay, this whole program is going to be aired on YouTube, so that every participant will be able to take a look at their progress. Their families will be able to look at their progress. We're asking their families to help and support them as well.
Yes.
One of the things that I see each person as a unique individual, and my goal is to help them get their God-given talents and bring them out in them. And one of the questions that I ask people is, first impressions are so important. And what is the first impression do you think, being obese, that people think of you?
Well, people don't want to associate with you. People don't want to give you a job. Unfortunately, when you meet people, the first thing we look at is their outside.
Right.
You know,
We don't look at the heart. We don't look at the kindness.
how it is. So, and the idea here is, for what we're doing is not for you to be thin, but for you to be healthier.
Right.
So I'm not promoting thinness. I'm
We're not promoting size 0.
Right. I don't care if you're size 2, 3, 10, 12, 14, 16. But from my perspective, it's to decrease your comorbid conditions. So high blood pressure, heart disease, diabetes, stroke,
Right.
peripheral vascular disease. So from my perspective, is to make you healthier by losing weight. But I'm not promoting for you to be thin.
Great.
And to be healthier from within to the outside. That's the idea of what we're promoting.